3.1 Introduction. As such, when we talk about assessment and evaluation in forensic psychology, they are not different from assessment and evaluation that generally takes place in psychology. Though, in the context of forensic psychology, the assessment and evaluation becomes relevant due to its implication, as often the results and the interpretations are to be produced in court based on which certain decisions could be taken. The main use of forensic assessment is to assess the mental capacity and functioning of the individual that is often reported to the court. They are also used to assess the competency of the individuals and identify any future risks. Forensic psychology represents the intersection between law and psychology. Psychologists are expected to render expert opinions needed for legal determinations. They also conduct psychological testing, which is highly objective and accurate, which are in turn used for taking fair judicial decisions and make fair judgment. The assessment and evaluation in forensic psychology is not as such different from that in other fields. In the present unit, we will discuss the role of assessment and evaluation in forensic psychology and will also look at various psychological tests that can be used. 3.2 Role of assessment and evaluation in forensic psychology. Forensic psychology is a branch of psychology and, therefore, it is not possible to separate the developments in forensic psychology from the developments in the broader discipline. As a result, many of the psychological assessment techniques, tests and measurements used for the assessment of offenders for forensic purposes have their origins outside the field. Their availability to forensic psychologists is contingent on developments in academic, educational and clinical psychology. The APA Dictionary of Psychology defines psychological assessment as the gathering and integration of data in order to make a psychological evaluation, decision, or recommendation. Multiple tools of assessment are interview, behavioral observations, tests, and other specialized instruments. A psychological test is a standardized instrument, that is, a test, inventory, or scale, used for the purpose of measuring any variety of abilities, aptitudes, or attributes. The practice of forensic psychology relies heavily on psychological research and assessment tools. Forensic psychologists frequently use tools like Minnesota Multiphasic Personality Inventory 2, Wechsler Intelligence Test, HERP Psychopathic Checklist Version, Structured Interview of Reported Symptom, and Personality Assessment Inventories. The forensic assessment differs from traditional testing in some important ways, which include purpose and understanding of who is being served. The major difference is that in mental health evaluation the client is the examinee, whereas in forensic evaluation specific legal questions regarding the examinee has to be addressed in order to assist in decision making. Forensic examinee are frequently mandated for an evaluation and often assumed to have significant reasons to be purposefully selective in self-disclosure, so that a much stronger focus must be placed on examiner objectivity and assessment of examinee's response style. Because of threats of conscious deception or selective self-presentation in forensic evaluations, there is more emphasis on use of multiple sources of data to verify information, as well as strong reliance on external sources, i.e. collateral observations, historical records, and reports of others, apart from the formal assessment interactions with the examinee. Forensic psychology assessment and evaluation is more than a mere psychometric evaluation, and this evaluation and assessment includes assessment of criminal responsibility, trial competency, assessment of malingering, assessment of mental health and identifying mental disability, neuropsychological assessment, and so on. Box 3.1 Distinction between forensic evaluation and therapeutic evaluation. You have learned that the forensic psychologist is asked to make evaluation of defendant's mental state. Now if you study the distinction between forensic and therapeutic evaluation, your concept of forensic psychology will be better. A forensic psychologist's interactions with the ethical responsibilities to the client differ widely from those of a psychologist dealing with a client in clinical setting. A. Scope. Rather than the broad set of issues a psychologist addresses in clinical setting, a forensic psychologist addresses a narrowly defined set of events or interactions of a non-clinical nature. B. Importance of client's perspective. A clinician places primary importance on understanding the client's unique point of view, while the forensic psychologist is interested in accuracy, and the client's viewpoint is secondary. C. Voluntariness. Usually in clinical setting a psychologist is dealing with a voluntary client. A forensic psychologist evaluates clients by order of a judge or at behest of an attorney. D. Autonomy. Voluntary clients have more latitude and autonomy regarding the assessment objectives. Any assessment usually takes their concerns into account. The objectives of a forensic examination are confined by the applicable statutes or common law elements that pertain to the legal issue in question. V. Threats to validity. While the client and therapist are working towards a common goal, although unconscious distortion may occur, in the forensic context there is a substantially greater likelihood of intentional and conscious distortion. F. Relationship and dynamics. Therapeutic interactions work towards developing a trusting, empathic therapeutic alliance. A forensic psychologist may not ethically nurture the client or act in a helping role, as the forensic evaluator had divided loyalties and there are substantial limits on confidentiality he/she can guarantee the client. A forensic evaluator must always be aware of manipulation in the adversary context of a legal setting. These concerns mandate an emotional distance that is unlike a therapeutic interaction. G. Pace and setting. Unlike therapeutic interactions which may be guided by many factors, place great time constraints on the evaluation without opportunities for revaluation. The forensic examiner focuses on the importance of accuracy and the finality of legal dispositions. 3.3 Assessment, Tests and Evaluation in Forensic Psychology. While there are some instruments specifically developed for forensic use, like structured interviews, rating scales, or tests designed for use with a particular legal application in mind like Competence Assessment Instrument for Standing Trial, CAA, Psychopathy Checklist Revised, PCLR, and Competence Assessment Instrument for Standing Trial for Defendants with Mental Retardation, CAST/MR. There are also many other instruments which are used in other settings that can be used in forensic field. Quite frequently other instruments, developed for non-forensic purposes, are used in a forensic assessment because of the vast research on the instruments, validity indicators built into some of the instruments, or ability for these tests to contribute to a broad understanding of the person to develop hypotheses related to factors bearing on the legal question. Such tests are personality tests, tests of malingering, and cognitive tests including IQ, intelligence quotient, measures. Whenever any test is used for forensic evaluation, important factors under consideration are a. Sufficient research and norms with a population similar to that of the examinee, b. Adequate test development and psychometric properties, and c. Ability to link test results to conclusions regarding the referral question. Some of the tests and techniques of evaluation are mentioned herewith. Mental status examination. A mental status examination, MSE, is an assessment of a patient's level of cognitive, knowledge-related, ability, appearance, emotional mood, and speech and thought patterns at the time of evaluation. It is one part of a full neurologic, nervous system, examination and includes the examiner's observations about the patient's attitude and cooperativeness as well as the patient's answers to specific questions. The most commonly used test of cognitive functioning per SE is the so-called Folstein Mental Status Examination, MMSE, developed in 1975. The purpose of a mental status examination is to assess the presence and extent of a person's mental impairment. The cognitive functions that are measured during the MSE include the person's sense of time, place, and personal identity, memory, speech, general intellectual level, mathematical ability, insight or judgment, and reasoning or problem-solving ability. Complete MSEs are most commonly given to elderly people and to other patients being evaluated for dementia. Dementia is an overall decline in a person's intellectual function, including difficulties with language, simple calculations, planning or decision-making, and motor, muscular movement, skills as well as loss of memory. The MSE is an important part of the differential diagnosis of dementia and other psychiatric symptoms or disorders. The MSE results may suggest specific areas for further testing or specific types of required tests. A mental status examination can also be given repeatedly to monitor or document changes in a patient's condition. The main components are appearance, attitude, and behavior, mood and affect, speech and language, thought process and content, perception, cognition, insight and judgment. Interview and cognitive interview. Interview is a face-to-face interaction between the interviewee and the interviewer. The salient features of conducting an effective interview are proper phrasing of interview questions, interview schedules, set of questions, statements, pictures or other stimuli to evoke responses, set of rules or procedures for using the schedules. Conducting the interview, evoking the responses or events that are to be classified. Recording the responses, paper, pencil notes, electronic equipments or other devices. The cognitive interview aims to enhance recall by subjects who are cooperative but unable to narrate the incident. It is important that the questioning in cognitive interviewing should be compatible with the cognitive abilities of the interviewee. The recall activity should include sensory motor imagery of the events. The probe needs to be of a specific nature to facilitate the flow of information and to ensure that all elements are covered, specifically asking about things such as the time at which events took place. The interviewer needs to mentally reinstate the incident, including the interviewee's feelings associated with it, and also focus on the external factors that the interviewees are able to recall. The interviewee is to be encouraged to report the events in a number of different sequences, i.e., besides recollecting in chronological order, also in reverse order or starting from the middle. Also, they can be asked to report events from alternative perspectives like that of another witness, the offender, or from other physical location. Retrieval method can be varied and extensive in order to facilitate recall to the maximum. Cognitive testing. The term cognition describes those mental processes that allow us to perform day-to-day functions, for example, the ability to pay attention, to remember and to solve problems are all parts of cognition. Cognitive tests are used to measure a person's cognition. Other terms for cognitive tests include neuropsychological tests, psychometric tests, psychological tests, intelligence tests or neurocognitive tests. Normally, tests are designed to assess a single or only a few aspects of cognition. This means that multiple tests must be administered to get an overall picture or map of an individual's cognitive ability. Cognitive tests can be categorized according to the aspect or domain of thinking that they aim to assess. The three most commonly cited domains of cognition are attention, memory, and executive function. Each of these broad domains encompasses more specific aspects of cognition. For example, at one level, memory can be broken down into short-term and long-term memory, while attention can be broken down into many components including sustained and divided attention. Each cognitive test is designed to measure performance in a limited number of domains of cognition, with additional domains assessed as different complexities which are added to the tasks. For example, attentional abilities are required to concentrate on and complete even the simplest of tasks, whilst preserved memory is additionally needed to perform well on tasks of new learning. Combining these individual tasks into a test battery can provide a more complete profile of a person's current cognitive state. Throughout the 20th century, paper and pencil cognitive tests were used commonly to measure intelligence, assist with the diagnosis of brain disorders such as Alzheimer's disease, and measure recovery from brain disease or injury. The first computerized cognitive tests were developed in the 1970s and 1980s. Computerized testing offers accurate recording of reaction time, electronic capture and processing of data, minimizing human error, and standardization of test administration, minimizing sources of response bias. Cognitive testing is a method to ascertain the functions of the brain, whether it is functioning well or otherwise. This technique has been developed in the field of neuropsychology, which includes a vast array of tests that measure basic intelligence, learning and memory, sensory perception and sensory muscle integration, reasoning and problem-solving skills, language and communication abilities, and basic academic skills. Cognitive testing is able to identify and to document the level of skill or the degree of impaired functioning of a person. The utility of this technique in the forensic field is in cases involving head injury, toxic exposure, or questions of competency or capacity. To name some of these tests, which SLA Adult Intelligence Scale, WAIS, Falstein Minimental State Examination, MMSE, and Halstead-Reaton Neuropsychological Test Battery. Psychological and behavioral profiling. Criminal psychological profiling. Criminal psychological profiling is a very effective tool in the area of crime investigation in general, and especially in the cases where a series of heinous crime, rape, murder, arson, and other violent crime, has occurred and it has not been possible to identify the perpetrator. Construction of criminal psychological profile from the scene of crime. Interview of the victims and witnesses may be of immense help in narrowing down to the probable suspects in such cases. Criminal profiling is a forensic technique which aims at providing the investigating agencies the specific information regarding the personality traits, behavioral tendencies and demographic variable of an offender based on the characteristics of the crime. The crime scene provides ample clue to the personality traits of the criminal. The criminal personality profile has to be drawn from good examination of crime scene and adequate information supplied to the forensic profiler. Archival information. Many forensic psychologists also make use of archival information while carrying out assessment. Archival information includes educational records, medical records, employment-related records, records related to mental health of the individual and so on. These are necessarily third-party information and may also include information gathered from significant others in the individual's life, his/her family members. The archival information and third-party information is especially important in order to ensure the accuracy of the forensic assessment. This does not imply that the forensic assessment can be incorrect, rather, an individual's freedom and well-being will depend on this assessment and the overall procedure of forensic assessment, and the report is subject to scrutiny and criticism from range of people including judges, lawyers, police personnel, opposing attorney and so on. Archival information and third-party information is also relevant because the likelihood of secondary gain is high in forensic assessment, which can also lead to increased likelihood of malingering or deception. The individuals could exaggerate or underemphasize certain symptoms during the assessment for their gains or benefit. And in such situations, archival information and third-party information can be helpful. Box 3.2 Psychological testing. Psychological testing constitutes administration of psychological tests. Here, it is important to understand what are psychological tests. Psychological tests can be described as tools that can be used to measure psychological entities like intelligence, personality, attitude, interest, achievement, motivation, and so on. Let us look at some of the definitions of psychological tests. Psychological test was defined by Gregory as a standardized procedure for sampling behavior and describing it with categories or scores. Psychological test can be described as measurement of sample of behavior that is standardized and objective. Kaplan and Sacuzzo explained psychological test, a device or technique used in quantification of behavior that helps in not only understanding behavior but also to predicting it. Some of the main properties of psychological tests are apparent from the definitions discussed above. To highlight these properties, psychological tests are objective in nature. They also have predictive and diagnostic value. A psychological test is also standardized, meaning that the procedure followed while administering and scoring the test is uniform and the instructions and scoring are provided in the manual of the test. Besides this, the manual will also provide information about the norms based on which an individual's score can be interpreted. Any psychological test measures a sample of behavior pertaining to certain psychological entity or variable. And though there are speed tests as well, often psychological tests are power tests, that is, the difficulty level of items increase gradually in their difficulty level. Thus, it is possible to identify the potential /ability of different individuals, those having higher and those having lower potentiality /ability. It denotes the extent of quality related to the psychological variable an individual has. A psychological test also needs to be valid and reliable. Validity can be described as the characteristics of a psychological test that states whether the test measures what it is supposed to or purports to measure. Thus, a test on adjustment needs to measure adjustment and a test on self-esteem needs to measure self-esteem. A ruler, that measures length, is not a valid instrument to measure weight, and a weighing machine is not a valid instrument to measure length. Similarly, a good psychological test needs to be valid and should measure the entity, or the sample of behavior, that it was developed to measure. Reliability denotes consistency of the psychological test over a period of time. For example, when a length of a table is measured with the help of a ruler on a certain day and then after 6 months, the length obtained will be same. Thus, the ruler can be termed as consistent instrument to measure the length. This is comparatively easy as table is a tangible entity and as such its length will not vary, unless it is broken or subjected to some other modification, in which case as well, such a modification or change will be easily visible. However, in case of psychological entities that are intangible, establishing reliability or consistency is a difficult task. Therefore, if a psychological test on adjustment is developed and it is administered on a group of adolescents, the scores obtained at a certain point and some time later, say after 6 months, need to be more or less same or similar. 3.4 Personality testing in forensic psychology. Central to the psychological perspective is the idea that almost all causes of criminal behavior originate in the personality. Personality is defined as the complex set of emotional and behavioral attributes that tend to remain relatively constant as the individual moves from situation to situation. Psychiatry goes a step further by postulating that mental illness and crime both have similar properties, in being responses to the same stressors and each having maladaptive qualities. As long ago as 1870, Henry Maudsley, in his book, Body and Mind, wrote that criminals would go insane if they didn't engage in crime. This is because their pathological urges must find expression in something. So, it has long been recognized that there is a strong relationship between mental illness and crime, not to say that one is the cause of another. Criminal adaptation to this condition of helplessness occurs because choosing crime over other possible alternatives provides certain psychological advantages or gratifications, which are as follows. Crime offers the possibility of excitement. Crime calls for the individual to maximize his faculties and talents which might otherwise lie dormant. Crime can relieve feelings of inner oppression and stress. Adopting the criminal role provides an excellent rationalization for inadequacy. Deviant behavior sometimes helps the criminal to form close and relatively non-oppressive relations with other criminals. Crime can provide pleasure or gratify needs. One of the major purposes of personality test is to assess the match between a person's personality profile and the required job profile, and thus screen out candidates. It is very likely that as part of job selection process a candidate will have to face a personality test. While the job interview examines the person's overt behavior, the personality test aims to reach deeper, and expose those areas that the person may not be aware of, thereby providing recruiters with a more comprehensive profile of the candidate's personality. The information provided by the personality test, coupled with the interview and the other psychometric tests including aptitude tests, helps the evaluator to put the pieces together and get an overall impression of the applicant. Thus, personality testing, irrespective of it being used in forensic field or employment field or any other field, is used to gather information to allow psychologists to describe what a person is like, how the person functions or is likely to function with others, whether there is significant psychopathology, extent to which a person is open and transparent in self-presentation or guarded or even deceptive, and prognosis for improvement with treatment for mental health problems. In forensic field, the personality testing is utilized to address questions like risk assessment, mental illness diagnosis and treatment recommendations, competency and capacity, tort cases where emotional distress claims are made, and criminal cases where mental illness factors are being presented. Some of the personality tests are described as follows. The Minnesota Multiphasic Personality Inventory, MMPA. It is known as the MMPI, and its revised second edition, MMPI-2, are psychological assessment instruments completed by the person being evaluated, and scored and interpreted by the examiner. The clinician evaluates the test taker's personal characteristics. By analyzing the test taker's patterns of response to the test items, the examiner is able to draw some tentative conclusions about the client's level of adaptation, behavioral characteristics, and personality traits. The MMPI-2 is preferred to the older MMPI because of its larger and more representative community comparison group, also referred to as the normative group. The results of the MMPI-2 allow the test administrator to make inferences about the client's typical behaviors and way of thinking. The test outcomes help the examiner to determine the test taker's severity of impairment, outlook on life, approaches to problem solving, typical mood states, likely diagnoses, and potential problems in treatment. The MMPI-2 is used in a wide range of settings for a variety of procedures. In addition, the instrument is often used by expert witnesses in forensic settings as part of an evaluation of a defendant's mental health, particularly in criminal cases. The MMPI has also been used to evaluate candidates for employment in some fields, and in educational counseling. Personality Assessment Inventory. The Personality Assessment Inventory, PI, provides information relevant for clinical diagnosis, treatment planning and screening for psychopathology. The PI covers constructs most relevant to a broad-based assessment of mental disorders. This is a 344-item instrument, requires 50 to 60 minutes to administer. Each item is rated on a 4-point scale ranging from false, not at all true, to very true. The PI consists of 22 non-overlapping full scales covering the constructs most relevant to a broad-based assessment of mental disorders, 4 validity scales, 11 clinical scales, 5 treatment scales, and 2 interpersonal scales. To facilitate interpretation and cover the full range of complex clinical constructs, 10 full scales contain conceptually derived subscales. Personality Inventory Revised, NEO-PIR. The Neo-Personality Inventory, NEO-PIR, is a highly regarded assessment of personality. Based on the 5-factor model, the NEO-PIR measures the interpersonal, motivational, emotional, and attitudinal styles of adults and adolescents. It consists of 240 personality items and 3 validity items, and is available in 2 forms. Form S is designed for self-reports and Form R is written in the third person for observer reports. It is used in the following areas: in counseling and clinical settings with adults as well as senior high school and college students. In business and industrial settings. Psychological research, including studies in sports psychology and recreation. The NEO-PIR was designed to provide a general description of normal personality relevant to clinical, counseling and educational situations. NEO-PIR items and materials were designed to be easily read and understood. The 5 domains, factors, measured by the NEO-PIR provide a general description of personality, while the facet scales allow more detailed analysis. These 5 factors and their facet scales include A. Neuroticism, anxiety, hostility, depression, self-consciousness, impulsiveness, vulnerability. B. Extraversion, warmth, gregariousness, assertiveness, activity, excitement-seeking, positive emotions. C. Openness to experience, fantasy, aesthetics, feelings, actions, ideas, values. D. Agreeableness, trust, modesty, compliance, altruism, straightforwardness, tender-mindedness. E. Conscientiousness, competence, self-discipline, achievement, striving, dutifulness, order, deliberation. Projective tests. In psychology, a projective test is a type of personality test in which the individual offers responses to ambiguous scenes, words or images. This type of test emerged from the psychoanalytic school of thought, which suggested that people have unconscious thoughts or urges. These projective tests were intended to uncover such unconscious desires that are hidden from conscious awareness. In many projective tests, the participant is shown an ambiguous image and then asked to give the first response that comes to mind. The key to projective tests is the ambiguity of the stimuli. According to the theory behind such tests, clearly defined questions result in answers that are carefully crafted by the conscious mind. By providing the participant with a question or stimulus that is not clear, the underlying and unconscious motivations or attitudes are revealed. These tests are used in forensic setting in order to find out the underlying psychodynamics of a criminal behavior. 3.5 Let us sum up. To summarize, in the present unit, we discussed about assessment and evaluation in forensic psychology. The forensic assessment differs from traditional testing in some important ways which include purpose, and understanding of who is being served. The major difference is that in mental health evaluation the client is the examinee, whereas in forensic evaluation specific legal questions regarding the examinee has to be addressed in order to assist in decision making. Forensic psychology assessment and evaluation is more than a mere psychometric evaluation, and this evaluation and assessment includes assessment of criminal responsibility, trial competency, assessment of malingering, assessment of mental health and identifying mental disability, neuropsychological assessment and so on. The unit discussed about tests and techniques used in assessment and evaluation in forensic psychology, including mental status examination, interview and cognitive interview, cognitive testing, psychological and behavioral profiling and archival information. Personality testing in forensic psychology was also discussed.